Welcome. In this video, you'll tackle 50 of the most difficult ECG interpretation and cardiac management case studies designed to challenge your clinical judgment, just like the Nclex. You'll analyze ECG rhythms, recognize life-threatening cardiac emergencies, identify priority nursing interventions, and apply critical thinking to realistic patient scenarios. Grab a notebook, pause when needed, and test yourself before revealing each answer. Let's get started. Question 1. A 68-year-old man arrives in the emergency department complaining of crushing chest pain and diaphoresis. The cardiac monitor shows ST segment elevation in leads 2, 3, and AVF. His blood pressure is 92/58 mmHg, heart rate is 48 per minute, and oxygen saturation is 95% on room air. Which nursing action should be prioritized? A. Prepare the client for immediate reperfusion therapy while monitoring for right ventricular involvement. B. Administer metoprolol to reduce myocardial oxygen demand. C. Encourage the client to ambulate to improve coronary circulation. D. Place the client in Trendelenburg position. Answer: A. Prepare the client for immediate reperfusion therapy while monitoring for right ventricular involvement. Rationale: ST elevation in leads 2, 3, and AVF indicates an inferior STEMI, commonly involving the right coronary artery. Bradycardia and hypotension suggest possible right ventricular infarction. Rapid reperfusion is the priority while avoiding interventions that may worsen hypotension. Question 2. A client admitted for palpitations has an ECG showing a narrow complex tachycardia at 180 beats/min with no clearly visible P waves. The client is alert, BP 118/74 mmHg, and denies chest pain. What should the nurse anticipate first? A. Immediate synchronized cardioversion. B. Vagal maneuvers followed by adenosine, if ineffective. C. Defibrillation. D. Continuous chest compressions. Answer: B. Vagal maneuvers followed by adenosine, if ineffective. Rationale: stable supraventricular tachycardia, SVT, is initially managed with vagal maneuvers. If unsuccessful, adenosine is the first-line medication. Question 3. A client suddenly becomes unresponsive. The monitor displays ventricular fibrillation. What is the nurse's priority action? A. Administer atropine. B. Begin CPR and prepare for immediate defibrillation. C. Obtain a 12-lead ECG. D. Administer adenosine. Answer: B. Begin CPR and prepare for immediate defibrillation. Rationale: ventricular fibrillation is a pulseless, shockable rhythm. Immediate CPR and early defibrillation provide the greatest chance of survival. Question 4. A client receiving digoxin develops nausea, blurred yellow vision, and an irregular pulse of 42 per minute. The ECG reveals frequent premature ventricular contractions, PVCs. Which action is most appropriate? A. Administer the next dose of digoxin. B. Hold digoxin and notify the healthcare provider. C. Encourage increased potassium restriction. D. Administer epinephrine. Answer: B. Hold digoxin and notify the healthcare provider. Rationale: bradycardia, visual disturbances, nausea, and ventricular ectopy are classic signs of digoxin toxicity. The medication should be withheld immediately. Question 5. A client develops new-onset atrial fibrillation with a ventricular rate of 140 per minute. The blood pressure is 84/50 mmHg, and the client reports dizziness. Which intervention should the nurse expect? A. Oral metoprolol. B. Synchronized cardioversion. C. Observation only. D. Vagal maneuvers. Answer: B. Synchronized cardioversion. Rationale: unstable atrial fibrillation with hypotension requires immediate synchronized cardioversion to restore perfusion. Question 6. A telemetry monitor shows a prolonged PR interval of 0.28 seconds, with every P wave followed by a QRS complex. The client has no symptoms. Which rhythm is present? A. First-degree AV block. B. Second-degree AV block type 2C. Third-degree AV block. D. Sinus arrest. Answer: A. First-degree AV block. Rationale: a prolonged PR interval greater than 0.20 seconds with consistent conduction identifies first-degree AV block, which often requires only monitoring. Question 7. A client recovering from myocardial infarction suddenly develops frequent multifocal PVCs occurring in couplets. Which nursing action is the priority? A. Continue routine monitoring. B. Assess the client and notify the provider immediately. C. Encourage coughing exercises. D. Remove telemetry leads. Answer. B. Assess the client and notify the provider immediately. Rationale. Frequent multifocal PVCs after an MI increase the risk of ventricular tachycardia and ventricular fibrillation and require prompt evaluation. Question 8. An ECG demonstrates regular P waves and QRS complexes, but the PR intervals progressively lengthen until one QRS complex is dropped. Which rhythm is this? A. Mobitz I, Wenckebach. B. Mobitz 2C, complete heart block. D. Junctional rhythm. Answer. A. Mobitz I, Wenckebach. Rationale. Progressive PR prolongation followed by a dropped QRS complex is characteristic of second-degree AV block type 1. Question 9. A client with chest pain develops sustained ventricular tachycardia and becomes hypotensive with altered mental status but still has a pulse. Which treatment is indicated? A. Synchronized cardioversion. B. Defibrillation. C. Adenosine. D. Observation. Answer. A. Synchronized cardioversion. Rationale. Unstable ventricular tachycardia with a pulse requires synchronized cardioversion. Question 10. A nurse reviews an ECG showing absent P waves, irregular RR intervals, and a ventricular rate of 92 per minute. The client is stable. Which complication should the nurse focus on preventing? A. Pulmonary edema. B. Stroke from thromboembolism. C. Complete heart block. D. Cardiac tamponade. Answer. B. Stroke from thromboembolism. Rationale. Atrial fibrillation significantly increases the risk of atrial thrombus formation and embolic stroke, making anticoagulation assessment a priority. Question 11. A client in the coronary care unit suddenly develops a heart rate of 36 per minute. The ECG shows regular P waves and QRS complexes, but there is no relationship between them. The client is confused, pale, and has a blood pressure of 78/46 mmHg. Which intervention should the nurse anticipate first? A. Administer adenosine 4. B. Prepare for transcutaneous pacing. C. Encourage the client to cough forcefully. D. Administer diltiazem 4. Answer. B. Prepare for transcutaneous pacing. Rationale. The ECG indicates third-degree, complete, AV block. Symptomatic complete heart block with hypotension requires immediate pacing while preparing for a permanent pacemaker, if indicated. Question 12. A client reports intermittent palpitations. Telemetry shows occasional premature atrial contractions, PACs. Vital signs are stable, and the client denies chest pain or dizziness. What is the most appropriate nursing action? A. Prepare for immediate synchronized cardioversion. B. Continue monitoring and assess for precipitating factors. C. Begin CPR immediately. D. Administer atropine. Answer. B. Continue monitoring and assess for precipitating factors. Rationale. PACs are often benign and may be triggered by stress, caffeine, alcohol, or electrolyte disturbances. Stable clients generally require observation and correction of underlying causes. Question 13. A client receiving 4-potassium replacement begins complaining of muscle weakness. The ECG now shows tall, peak T waves and widening of the QRS complex. Which action should the nurse take first? A. Stop the potassium infusion immediately. B. Encourage oral fluids. C. Administer another dose of potassium. D. Reposition the ECG electrodes. Answer. A. Stop the potassium infusion immediately. Rationale. Peak T waves and QRS widening are signs of hyperkalemia, which can rapidly progress to life-threatening dysrhythmias. The potassium infusion should be stopped immediately. Question 14. A client with chronic atrial fibrillation is prescribed warfarin. Which statement by the client indicates correct understanding of the medication? A. I can stop taking it once my heartbeat becomes regular. B. I'll report any unusual bleeding or black stools. C. I should double my dose if I miss one. D. I don't need routine blood tests. Answer. B. I'll report any unusual bleeding or black stools. Rationale: warfarin increases bleeding risk. Clients should monitor for signs of bleeding and undergo regular INR monitoring. Question 15. A telemetry monitor alarms for ventricular tachycardia. The nurse enters the room and finds the client awake, talking, and without symptoms. What is the nurse's priority action? A. Assess the client and verify the rhythm before initiating treatment. B. Immediately begin chest compressions. C. Deliver unsynchronized defibrillation. D. Remove the telemetry monitor. Answer: A. Assess the client and verify the rhythm before initiating treatment. Rationale: always assess the client first. Artifact from movement or loose leads can mimic ventricular tachycardia. Treatment should be based on both the rhythm and the client's condition. Question 16. A client admitted with heart failure develops sinus tachycardia at 118 beats/min. Which finding most likely explains this rhythm? A. Increased myocardial oxygen demand due to decreased cardiac output. B. Complete AV node failure. C. Hypercalcemia. D. Excess vagal stimulation. Answer: A. Increased myocardial oxygen demand due to decreased cardiac output. Rationale: sinus tachycardia commonly occurs as a compensatory response to reduced cardiac output in heart failure. Question 17. Following cardiac catheterization, a client suddenly develops chest pain, hypotension, jugular venous distension, and muffled heart sounds. The ECG shows sinus tachycardia. Which complication should the nurse suspect? A. Pulmonary embolism. B. Cardiac tamponade. C. Pericarditis. D. Stable angina. Answer: B. Cardiac tamponade. Rationale: Beck's triad, hypotension, jugular venous distension, and muffled heart sounds, strongly suggests cardiac tamponade, a medical emergency requiring immediate intervention. Question 18. A client with an implanted permanent pacemaker reports dizziness. The ECG shows pacing spikes that are not followed by QRS complexes. What does this finding indicate? A. Normal pacemaker function. B. Failure to capture. C. Failure to sense. D. Sinus arrhythmia. Answer: B. Failure to capture. Rationale: pacing spikes without subsequent myocardial depolarization, QRS complexes, indicate failure to capture, requiring immediate evaluation. Question 19. A client develops chest discomfort while walking in the hallway. Telemetry shows horizontal ST segment depression. What is the nurse's priority action? A. Continue ambulation to improve circulation. B. Stop activity, assess the client, and notify the provider. C. Increase for fluids rapidly. D. Remove the telemetry monitor. Answer: B. Stop activity, assess the client, and notify the provider. Rationale: ST segment depression indicates myocardial ischemia. Activity should be stopped immediately, and the client should be assessed and treated promptly. Question 20. A client is admitted after successful resuscitation from ventricular fibrillation. Which electrolyte imbalance places the client at greatest risk for recurrence of this dysrhythmia? A. Hypernatremia. B. Hypokalemia. C. Hypermagnesemia. D. Hyperphosphatemia. Answer: B. Hypokalemia. Rationale: hypokalemia increases myocardial irritability and significantly raises the risk of ventricular dysrhythmias, including ventricular fibrillation. Question 21. A client with acute chest pain has an ECG showing ST segment elevation in leads V1, V4. The nurse recognizes this pattern as indicating which condition? A. Inferior wall myocardial infarction. B. Lateral wall myocardial infarction. C. Anterior wall myocardial infarction. D. Posterior wall myocardial infarction. Answer: C. Anterior wall myocardial infarction. Rationale: ST segment elevation in leads V1, V4 indicates an anterior wall STEMI, usually caused by occlusion of the left anterior descending LAD artery. This infarction can involve a large portion of the left ventricle and requires immediate reperfusion therapy. Question 22. A client with atrial fibrillation is receiving an 4-diltiazem infusion. 30 minutes later, the heart rate decreases from 150 per minute to 88 per minute, but the blood pressure falls to 82/48 mmHg. What is the nurse's priority action? A. Increase the infusion rate to maintain rhythm control. B. Stop or reduce the infusion and notify the healthcare provider. C. Encourage the client to ambulate. D. Administer adenosine for. Answer. B. Stop or reduce the infusion and notify the healthcare provider. Rationale. Diltiazem can cause hypotension. Symptomatic hypotension requires prompt assessment, adjustment of the infusion, and provider notification. Question 23. A client's telemetry rhythm shows 6 consecutive wide QRS complexes at a rate of 160 per minute before spontaneously returning to normal sinus rhythm. The client remains asymptomatic. How should the nurse document this rhythm? A. Sustained ventricular tachycardia. B. Non-sustained ventricular tachycardia. C. Ventricular fibrillation. D. Accelerated junctional rhythm. Answer. B. Non-sustained ventricular tachycardia. Rationale. 3 or more consecutive ventricular beats lasting less than 30 seconds define non-sustained ventricular tachycardia. Question 24. While reviewing telemetry, the nurse notes a rhythm with no identifiable P waves, a chaotic baseline, and an irregular ventricular rhythm. Which dysrhythmia is present? A. Atrial flutter. B. Atrial fibrillation. C. Sinus tachycardia. D. First-degree AV block. Answer. B. Atrial fibrillation. Rationale. Atrial fibrillation is characterized by absent P waves, fibrillatory activity, and an irregular ventricular rhythm. Question 25. A client complains of sudden dizziness while on telemetry. The ECG reveals sinus pauses lasting 4 seconds. Which intervention should the nurse anticipate? A. Encourage deep breathing only. B. Evaluate for temporary or permanent pacemaker placement. C. Administer epinephrine orally. D. Begin thrombolytic therapy. Answer. B. Evaluate for temporary or permanent pacemaker placement. Rationale. Symptomatic sinus node dysfunction causing prolonged pauses often requires pacing to prevent decreased cerebral perfusion. Question 26. A client receiving 4-amiodarone for ventricular tachycardia develops a prolonged QT interval on the ECG. Which complication is the nurse most concerned about? A. Atrial flutter. B. Torsades de pointes. C. First-degree AV block. D. Sinus arrhythmia. Answer. B. Torsades de pointes. Rationale. QT prolongation significantly increases the risk of torsades de pointes, a potentially fatal polymorphic ventricular tachycardia. Question 27. A client arrives in the emergency department with severe chest pain. The ECG demonstrates ST segment depression and T-wave inversion. Cardiac troponin levels are elevated. Which diagnosis is most consistent with these findings? A. Stable angina. B. STEMI. C. Pericarditis. D. Benign early repolarization. Answer. B. STEMI. Rationale. Elevated cardiac biomarkers with ischemic ECG changes but without ST elevation indicate a non-ST elevation myocardial infarction, STEMI. Question 28. The telemetry monitor alarms for asystole. Before activating the emergency response system, what should the nurse do first? A. Verify the rhythm in another lead and assess the client for responsiveness and a pulse. B. Immediately defibrillate the client. C. Administer adenosine for. D. Prepare for synchronized cardioversion. Answer. A. Verify the rhythm in another lead and assess the client for responsiveness and a pulse. Rationale. Loose leads or equipment malfunction can mimic asystole. The nurse must first confirm the rhythm while simultaneously assessing the client. Question 29. A client with symptomatic bradycardia receives 4-atropine, but the heart rate remains 34 per minute and the blood pressure continues to fall. According to ACLS principles, what is the next appropriate intervention? A. Administer adenosine. B. Prepare for transcutaneous pacing. C. Encourage the client to cough. D. Administer diltiazem. Answer. B. Prepare for transcutaneous pacing. Rationale. If atropine is ineffective in symptomatic bradycardia, transcutaneous pacing is the next recommended intervention while preparing for more definitive therapy. Question 30. A client with acute myocardial infarction suddenly develops frequent premature ventricular contractions occurring every other beat, ventricular bigeminy. Which nursing assessment is the highest priority? A. Assess for chest pain, perfusion, and hemodynamic stability. B. Ask about the client's dinner intake. C. Encourage ambulation to decrease ectopy. D. Turn off the telemetry alarm. Answer. A. Assess for chest pain, perfusion, and hemodynamic stability. Rationale. Ventricular bigeminy after an acute MI may indicate worsening myocardial irritability and can progress to more serious ventricular dysrhythmias. Immediate assessment of the client's clinical status guides further treatment. Question 31. A client admitted with chest pain has an ECG showing ST segment elevation in leads I, AVL, V5, and V6. Which area of the heart is most likely affected? A. Inferior wall. B. Septal wall. C. Lateral wall. D. Posterior wall. Answer. C. Lateral wall. Rationale. ST segment elevation in leads I, AVL, V5, and V6 indicates a lateral wall myocardial infarction, typically involving the left circumflex artery or diagonal branches of the left anterior descending artery. Question 32. A client with heart failure develops atrial flutter with a ventricular rate of 150 per minute. The client is alert, BP 122/76 mmHg, and oxygen saturation is 96%. Which intervention should the nurse anticipate first? A. Immediate defibrillation. B. Rate control with medications as prescribed. C. Begin chest compressions. D. Administer atropine. Answer. B. Rate control with medications as prescribed. Rationale. A stable client with atrial flutter is generally managed with rate-controlling medications such as beta blockers or calcium channel blockers before considering cardioversion. Question 33. The nurse is evaluating a client with chest pain. The ECG reveals deeply inverted T waves without ST segment elevation. What do these findings most likely indicate? A. Myocardial ischemia. B. Hypercalcemia. C. Normal aging changes. D. Pericardial effusion. Answer. A. Myocardial ischemia. Rationale. T-wave inversion commonly reflects myocardial ischemia and should be correlated with symptoms and cardiac biomarkers. Question 34. A client with a history of coronary artery disease suddenly develops pulseless ventricular tachycardia. What is the priority intervention? A. Synchronized cardioversion. B. Immediate defibrillation with high-quality CPR. C. Obtain a 12-lead ECG. D. Administer atropine. Answer. B. Immediate defibrillation with high-quality CPR. Rationale. Pulseless ventricular tachycardia is a shockable cardiac arrest rhythm requiring immediate defibrillation and CPR. Question 35. A client's ECG shows a heart rate of 52 per minute with upright P waves before every QRS complex and a PR interval of 0.16 seconds. The client denies dizziness or chest pain. How should the nurse interpret this rhythm? A. Sinus bradycardia. B. Junctional rhythm. C. Second-degree AV block. D. Ventricular escape rhythm. Answer. A. Sinus bradycardia. Rationale. A normal sinus rhythm with a rate below 60 beats/min is sinus bradycardia. Asymptomatic clients often require only monitoring. Question 36. A client recovering from cardiac surgery develops frequent PVCs. Laboratory results show a serum potassium level of 3.1 milliequivalent/L. Which intervention should the nurse expect? A. Restrict potassium intake. B. Potassium replacement as prescribed. C. Administer sodium bicarbonate. D. Encourage caffeine intake. Answer. B. Potassium replacement as prescribed. Rationale. Hypokalemia increases myocardial irritability and contributes to ventricular ectopy. Correcting the potassium level often reduces PVCs. Question 37. A client's telemetry strip demonstrates a sawtooth pattern of flutter waves with a ventricular rate of approximately 75 per minute. Which rhythm does the nurse identify? A. Atrial flutter. B. Atrial fibrillation. C. Ventricular tachycardia. D. Sinus arrhythmia. Answer. A. Atrial flutter. Rationale. The classic sawtooth flutter waves are diagnostic of atrial flutter. The ventricular rate depends on the AV conduction ratio. Question 38. A client experiences sudden chest pain and shortness of breath. The ECG shows sinus tachycardia with new right axis deviation. Which condition should the nurse suspect? A. Pulmonary embolism. B. Acute pericarditis. C. Stable angina. D. First-degree AV block. Answer: A. Pulmonary embolism. Rationale: although sinus tachycardia is the most common ECG finding in pulmonary embolism, new right heart strain patterns such as right axis deviation increase suspicion for this emergency. Question 39. A client receiving magnesium sulfate for torsades de pointes asks why this medication is being given despite having a normal magnesium level. Which response by the nurse is most accurate? A. Magnesium helps stabilize the heart's electrical activity and suppresses this rhythm. B. It permanently cures all abnormal heart rhythms. C. It increases your heart rate immediately. D. It dissolves blood clots in the coronary arteries. Answer: A. Magnesium helps stabilize the heart's electrical activity and suppresses this rhythm. Rationale: for magnesium sulfate is the treatment of choice for torsades de pointes because it stabilizes myocardial electrical activity, even when the serum magnesium level is normal. Question 40. A client with an acute myocardial infarction suddenly reports severe chest pain that is not relieved after 3 doses of sublingual nitroglycerin given 5 minutes apart. Which nursing action is the highest priority? A. Reassure the client that the medication needs more time to work. B. Notify the healthcare provider immediately and prepare for urgent reperfusion or additional interventions. C. Encourage the client to walk to improve coronary circulation. D. Discontinue continuous ECG monitoring. Answer: B. Notify the healthcare provider immediately and prepare for urgent reperfusion or additional interventions. Rationale: persistent ischemic chest pain despite nitroglycerin suggests ongoing myocardial injury. Rapid escalation of care is essential to restore coronary perfusion and minimize myocardial damage. Question 41. A client admitted with an acute myocardial infarction suddenly develops chest pain that worsens with inspiration and is relieved by sitting forward. The ECG shows diffuse ST segment elevation and PR segment depression. Which condition should the nurse suspect? A. Reinfarction. B. Acute pericarditis. C. Pulmonary embolism. D. Unstable angina. Answer: B. Acute pericarditis. Rationale: diffuse ST segment elevation with PR segment depression, along with pleuritic chest pain relieved by leaning forward, is characteristic of acute pericarditis. Question 42. A client with chronic heart failure is receiving furosemide. Telemetry reveals frequent PVCs, and laboratory results show a potassium level of 2.9 milliequivalent/L. Which intervention should the nurse implement first? A. Administer the scheduled dose of furosemide. B. Notify the provider and prepare to replace potassium as prescribed. C. Encourage the client to drink more coffee. D. Restrict foods containing potassium. Answer: B. Notify the provider and prepare to replace potassium as prescribed. Rationale: severe hypokalemia increases the risk of life-threatening ventricular dysrhythmias. Potassium replacement is the priority. Question 43. A client develops a regular wide complex tachycardia at 170 per minute. The client is awake but complains of chest pain, has a blood pressure of 80/50 seconds millimeter of mercury, and a palpable pulse. Which intervention is most appropriate? A. Defibrillation. B. Synchronized cardioversion. C. Adenosine after vagal maneuvers. D. Observation only. Answer: B. Synchronized cardioversion. Rationale: a client with unstable ventricular tachycardia and a pulse requires immediate synchronized cardioversion. Question 44. The nurse observes that a client's telemetry rhythm alternates between normal sinus beats and premature ventricular contractions. Every normal beat is followed by a PVC. How should this rhythm be documented? A. Ventricular trigeminy. B. Ventricular bigeminy. C. Couplet PVCs. D. Multifocal ventricular tachycardia. Answer: B. Ventricular bigeminy. Rationale: ventricular bigeminy occurs when every normal sinus beat is followed by a PVC. Question 45. A client with a history of hypertension experiences sudden severe chest pain radiating to the back. The ECG is nonspecific, but blood pressure is significantly higher in one arm than the other. Which condition should the nurse suspect? A. Acute pericarditis. B. Aortic dissection. C. Stable angina. D. Mitral valve prolapse. Answer: B. Aortic dissection. Rationale: tearing chest pain radiating to the back with unequal arm blood pressures strongly suggests an aortic dissection, a medical emergency. Question 46. A client recovering from an inferior wall myocardial infarction develops sinus bradycardia with a heart rate of 44 per minute but remains alert with a blood pressure of 118 to 70 mmHg and no symptoms. What is the most appropriate nursing action? A. Continue close monitoring without immediate intervention. B. Begin transcutaneous pacing immediately. C. Prepare for defibrillation. D. Administer epinephrine immediately. Answer: A. Continue close monitoring without immediate intervention. Rationale: sinus bradycardia is common after an inferior MI due to increased vagal tone. If the client is hemodynamically stable and asymptomatic, monitoring is appropriate. Question 47. A client's ECG demonstrates narrow QRS complexes with a regular ventricular rate of approximately 150 per minute and characteristic sawtooth flutter waves. Which conduction ratio is most likely present? A. 1:1 AV conduction. B. 2:1 AV conduction. C. 4:1 AV conduction. D. Complete AV block. Answer: B. 2:1 AV conduction. Rationale: atrial flutter commonly has an atrial rate of about 300 per minute. A ventricular rate near 150 per minute usually indicates 2:1 AV conduction. Question 48. During telemetry monitoring, the nurse notices progressive flattening of T waves followed by prominent U waves. Which electrolyte imbalance is most likely responsible? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Answer: B. Hypokalemia. Rationale: flattened T waves and prominent U waves are classic ECG findings of hypokalemia, which increases the risk for ventricular dysrhythmias. Question 49. A client is admitted with crushing chest pain lasting 45 minutes. The initial ECG is normal, but the troponin level is elevated. What should the nurse understand about these findings? A. A normal ECG completely rules out myocardial infarction. B. The elevated troponin suggests myocardial injury despite the normal ECG. C. The chest pain is most likely non-cardiac. D. The client should be discharged because the ECG is normal. Answer: B. The elevated troponin suggests myocardial injury despite the normal ECG. Rationale: a normal ECG does not exclude acute coronary syndrome. Elevated troponin is a sensitive marker of myocardial injury and requires prompt evaluation and treatment. Question 50. A client suddenly becomes unresponsive while on telemetry. The monitor shows a rapid, chaotic rhythm with no identifiable P waves, QRS complexes, or T waves. After activating the emergency response system, what should the nurse do next? A. Deliver immediate defibrillation while ensuring high-quality CPR is initiated. B. Administer atropine before CPR. C. Prepare for synchronized cardioversion. D. Obtain a 12-lead ECG before treatment. Answer: A. Deliver immediate defibrillation while ensuring high-quality CPR is initiated. Rationale: this rhythm is ventricular fibrillation, a pulseless, shockable rhythm. Early defibrillation combined with uninterrupted high-quality CPR offers the best chance of successful resuscitation. Excellent work completing all 50 case studies. The more you practice ECG interpretation and priority cardiac management, the more confident you'll become on exam day and in real clinical practice. If you found this session helpful, continue practicing consistently and review the questions you found most challenging. Keep sharpening your clinical reasoning. Success on the NCLEX comes one question at a time. See you in the next case study.